Hello everyone, this is your host Rohan Dandel from Inno Health Magazine studio. I welcome you to this podcast produced by InnovatorCLUB with a mission to spread awareness and knowledge of various facets of healthcare innovation. This podcast is the fifth in the series Voices of IC Innovator from Inno Health Magazine, the first magazine in India on healthcare innovations. In this series, we will be exploring the essence of the IC InnovatorCLUB through its club members' perspectives. Today, we are going to have a conversation with our guest speaker, Dr. Amit Raj. He has completed his education in healthcare management from Harvard Business School. He is an experienced promoter with a demonstrated history of working in the hospital and healthcare industry. He is skilled in cardiovascular intervention, cardiac fitness, healthcare management and leadership, and strategic planning. Welcome, Dr. Amit, to our podcast. How are you today, sir?
Thank you. It's been a pleasure to be a part of this amazing, magazine and also this lovely program. I'm good. How are you doing?
Sir, I'm good too.
Let's proceed.
So now coming to the podcast, let me elaborate on the flow of this podcast. I would be asking you a series of questions and we may discuss your views and opinions on it. So let us begin.
Yeah.
Through our career, we have various experiences giving us important lessons, be it a life or a career lesson, some of which we make the realization in our early stages of career, and some take a lot many years. So my question to you is, what is that one thing or that one lesson that you wish you knew at the start of your career, or for which you made a late realization?
Well, I mean, this is something not many have asked this, but I'm glad you had pointed out to this very important question. Well, a doctor's life is full of sacrifice, and we need constant updation of our knowledge and skill as we progress in our medical practice. So, being graduated from the MBBS days, the one thing which I wish I could knew at the start of my career is to innovate skills on giving back more to the society as a doctor, and probably innovate to enhance purpose of being a doctor. The reason is we feel, I feel personally is after MBBS days. I mean, there's a race to get yourself into post-graduation, start, going back to your theory and preparing for exams, like how, for pre-med exams. I mean, most of them youngsters do prepare. But we all fail to think this, concept of innovating, of knowledge building and as well as skill in our career. So this innovation to improve innovative skills, giving back more to the society, I think that's one part which I knew at the I wish I could knew at the beginning part of my career, but I developed that later. So once I realized what's there in being a doctor and how much we should give back more to the society as we progress in our career.
True, sir. Moving ahead.
Yeah.
We use many things to grow in our life, which we call the resources in our career. So like say books, technology, media, or say some quote, which makes a major influence on us, say impact on our life. But not all of the resources make equal impact. Some of them make a major impact, which make a great change in our life. So my question to you is, what are the resources that had a major influence on you as a professional or as an individual?
Well, amazing question. Once as a doctor, you get inside your regular medical practice and you kind of see patients across. But, how do we, improve our, skills and knowledge in reaching out to the masses is something which I felt was needed. And, I started my career in the cities like Pune and Bangalore, and where most of the patients were, my patients were of usually the tech background and from the IT. And also I had few IT tech friends in these cities. So constant interaction with my techies, made me think that, I need to collaborate, use tech into my approach to my patients and to improve, reach out to my patients in my medical practice. I think that made a major influence. Being surrounded with the techies as friends and as patients made me realize that how quick and how soon I can reach out to my patients to ease the communication skills where doctor and a patient can reach out to. So I feel that was a major influence on me.
Going ahead, like resources, we come across many personalities, of which some become our role models. So what I would like to ask is, which person or who were the people you idolize and why?
Well, I have a list of people who, I've kept as a mentor, and I idolize them both. Well, I can start with me being a doctor, then getting inside cardiac super specialty. I feel for me, Dr. Viveka Kumar, who is the senior cardiologist at Max Saket, and being a director in cardiology there, since 2015 days, with constant interaction with him, he's my mentor guide in cardiology for for being an amazing human being, and also highly skilled in interventional cardiology. And the most important is the approach to motivate young doctors and cardiologists is commendable. And I felt that I've learned a lot from him in cardiac sciences, and he's been kind enough to kind of guide me, mentor me in my progress. Coming back, being from the tech city, like Bangalore, I felt, meeting various techies. I feel two individuals played an important role where I can, learn and probably, look at some big collaborations with them in my, approach. Mr. Anil Meharia and Mr. Amber Jamadia, they are tech innovators. With a unique skill in understanding the medical needs of the hour, and with constant interaction, preparing an application of tech to support the mission of our mission of rural health digital approach. I think these two individuals have idealized me in kind of understanding the need for tech in our rural digital program. Well, every individual has a guru, has a mentor for their mind power training. I am obliged to to have Colonel P.P. Vyas as a guru in visualization and mind power training, and he's also a senior lead member of our rural health program, which we have started in Gujarat and at various states. Well, going ahead, yes, I have in being a medical healthcare leader, I feel Admiral V.K. Singh, being a mentor to many healthcare leaders, stands at top for his teaching strategy and being a wonderful human being, and also for his sheer aura of helping and motivating youngsters like me in kind of being a healthcare leader. So I feel he's been a very special part of my life, and I would definitely ask many people to kind of listen to his speeches, and he is an amazing human being per se as well. Dr. Khushbu and Mandakini Pawar, as leaders, mentors in healthcare administration and performance excellence, they've been helping me in my journey of healthcare administration at the hospital, and also constantly improving quality and ensuring that we are at par with our standards, and in collaboration with the quality part of the needs for India, like CII and NABH take their advices, kind of improve overall quality and improve our quality performance in the hospital. Well, these are the few members of my life. Whom I've kept as my mentors, guru, and I idealize them for their respective amazing skills, which makes them stand apart in my life.
So you have quite a wide variety of mentors, I would say.
Every specialty, for example, life, cardiac sciences, healthcare management, then look at the hospital level, we need, leaders who can, guide us in our day-to-day work, and then to constantly benchmarking ourselves from international standards. This is something which, that's the mission I have, and probably, I have these people as mentors and gurus to me. And I'm sure, I would definitely my path of success is I have a mission, and to reach there, and definitely with their support, I would definitely reach there in giving back more to the society.
Exactly, sir. As you said, you have this wide variety of mentors pertaining to different sections of the industry. So with a vision like that, you can progress with such a vision. So that's so commendable of you. Moving ahead, talking about careers. Many people face various hardships through their career or life. So I would like to know some of the hardships you faced in your career and how you found inspiration from such situations.
Well, this is something little personal though, but I've just put some few points on it. Yeah, well, as everybody's life has been, guided and molded by their parents and teachers. For me, yes, my parents struggled hard to, to upbring my brother and myself to become a good doctor and a good human being. I mean, they've been my inspiration always, and with the hardship they faced in their life, to mold us into professionals. I personally feel, I mean, they were and will always be my inspiration to kind of stand up hard in rough phases of my life. Seeing them struggle to make us, become successful in our careers. So, I mean, they are the inspiration for me to, kind of stand up and and perform.
Moving ahead, besides your current profession, what profession would you like to explore?
Well, this is something. I like teaching, and teaching and molding young generations in their medicine careers and into their early stage of career planning is something which I feel is the profession where I would like to also take up guiding and molding young generations in their medical careers.
Great, sir. Coming to my next question, every person does some activity or has some way in which they rejuvenate themselves. So my question to you is, what makes you feel your best self or say rejuvenate you from the daily workload and stress?
Well, I've been, listening to my dad playing music since my younger days. So, I have taken, guitar lessons from my younger days, school days rather. So I play guitar as, as a stress buster. And since my, school days, I've been performing in the school stage programs and in college and university level. I think, music is playing music for me is one of the, best stress buster for me. And also, I took up sports as a fitness regime into my fitness regime and being a sportsman playing various sports across, takes care of my fitness and also, sports brings out a competitive zeal to always excel. So this been there since childhood. So zeal to go ahead, the zeal to stand out, and sports is one domain which makes a person really fight it out hard to stand apart. So these two, music and sports, have been my the best stress and regenerators for me in my life.
True, sir. Those are some great stress busters, I feel. So now coming to IC InnovatorCLUB, what I would like to ask is what it means for you to be a member of the IC InnovatorCLUB.
Well, this is an amazing club. I really salute to Admiral V. K. Singh and Sachin Gaur for their amazing initiative of starting this Innovators Club, and they being stalwarts in starting this Innovators Club. I feel it's a privilege to be part of this Innovators Association and out of the box thinkers group, where I constantly want to be part of this group and learn a lot from different members and with various programs organized by this group. I mean, it's a privilege for me.
Moving ahead,
Yeah.
I would like to ask, what are the functions that this club performs and how does it help a member to grow as an individual?
Well, the club, I mean, Sachin and Admiral, so they organize discussions and brainstorming sessions in current situations and as well as for future perspectives and development. And I say they've been inviting industry leaders from various domains, probably have a brainstorming session with these people on their views on above, had really sharpened my skills and approach. And and of course, I kind of network with these out of the box thinkers in this in this club. I mean, this has made me really I'm privileged to all that I could kind of interact and learn more and sharpen my skills and approach.
Coming to my next question, what does innovation mean to you considering the healthcare industries?
Well, innovation, this is according to me. I feel innovation is to ease a healthcare delivery platform, reach out to many healthcare leaders with constant education and skill development and innovative methods to ease healthcare delivery, which overall improves the quality of healthcare. So constant innovation leads to constant improving in quality of healthcare. And as progress happens, new innovations again needs to be developed and sharpened to further, improve the quality and reach out to the public, and especially in pandemic. There are various innovations which have really brought in and bridged the gap between the patient and the healthcare workers, so that they get comforted at all levels of their disease, and pandemic being one of the reasons for us to constantly innovate new things to improve overall quality of healthcare.
Greatly said, sir. As innovation arises from the need, so it should reach the needful people.
Yes,
in the best possible manner.
Absolutely. That's, I think, innovative methods in Hindi, we call it Jugaad methods to kind of move on. But good innovative methods, are there, and constantly, I think there are many innovations which are yet to come in, overall improving, the quality of life and healthcare delivery.
True, sir. For my final question, where can our listeners connect to you?
They can reach out to my email ID, amit@cardia.care. And they can call me on my mobile, 9958544288. Though I'll be tied up with at the heart hospital, but they can reach out to me. WhatsApp me. I'll definitely revert back to them no sooner or later.
Okay, sir. The link and the contact information for our guest speaker, Dr. Amit Raj, will be down in the description. Thank you, Dr. Amit, for joining us on the podcast.
Thank you so much, bro. Really appreciate it. And with the kind of, need of the hour questions, this is amazing. The questions have been very, apt for the situation, and especially for listeners, it's been, they'll definitely learn, a lot from many people like me.
So, for concluding, I would also like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. You can also connect with us if you have a healthcare innovation journey of your own to be a part of our podcast series. And for more such content on healthcare and innovation, visit InnoHealthMagazine.com. Stay safe. Goodbye from your host, Rohan Dandel from Inno Health Magazine Studio. Thank you.